We have all heard the terms psychologist, psychiatric, and counselor, but we may not know exactly what is the difference between them. A consultant is someone with whom we only consult. We can get help from a consultant when we have doubts about making decisions and we do not know which path to choose. For example, the consultant shows us different ways, examines the pros and cons of each way, and allows us to make the final decision ourselves without any bias or tendency when we seek help for choosing our major, buying a car, or investing. In fact, it is not professional if the consultant directly tells you what decision to make. Their job is not to advise you and make the final decision for you. Depending on the difficulty of the decision we want to make, consulting sessions normally last between 4 sessions, each of which usually takes 45 minutes. Career, academic, and family consulting are 3 prominent roles in consultation. But what is the role of a psychologist? A psychologist specializes in understanding the function of the mind and human behavior. Some psychologists do research, some do treatment, and others get busy in the wider fields of this science. Here we talk about those psychologists who specialize in the treatment and are called psychotherapists, or therapists for short. Everyone has some sort of problem in life. These problems may be a simple conflict with our friend or wider and more difficult problems, such as suffering from a mental disorder. A clinician or a psychotherapist helps us manage these problems and solve them as much as possible when we face them and find ourselves incapable of getting over them alone. Based on the diagnosis of the therapist, the number of psychotherapy sessions normally varies between 5 and 50. In the first session, the psychologist will give you this information and will inform you how much time is needed to solve your problem. During the psychotherapy process, the therapist may come to the conclusion that you need to receive a specific medication to control the function of your brain. They explain to us that we need to see a psychiatrist instead. Let's say that you are a professional runner and you plan to get ready for competitions, but you injure your foot accidentally. You will not be able to run well and participate in the competition until your physical problem is solved, no matter how good a runner you are and how great your performance is. Such a problem may happen during the process of psychotherapy. That is, psychotherapy cannot be as effective as it should be if it is a physical problem, and it is not resolved yet. According to what has been told so far in this video, it can be deduced that a psychiatrist is specialized in neuroscience and accepts clients who need medical help in their psychotherapy sessions, and merely talking to a psychologist had not proved to be useful for them. Some people who see a psychiatrist without consulting a psychologist practically expose themselves to medication and physical treatments. But had they talked to a psychologist beforehand, they might have found their answers and had their problems taken care of without taking any kind of unnecessary medication. So, we need to see a consultant if we have problems making decisions, and we get help from a capable psychologist if we face deeper problems. The therapist will ask us to see a psychiatrist and take medications if necessary.